Hey guys, it's Miss Amanda. Just kind of setting things up here. I have a PowerPoint made where I'm going to go over just a couple questions, only three, using the Kaplan method, because I do know that several of you have not always used the Kaplan method and sometimes are using other methods. So it's just kind of a nice way to review. So I wanted to do that as well as, so first and foremost, it's been, wow, I don't even know how long, definitely a couple months since we ended class. I have kept in contact a couple times just to check in, see how you're doing, if you need support, any questions. I've was very pleased that, people really did reach out, and I really appreciate that. If you didn't need anything, then you didn't need anything, and that's fine too. I am still here, so if you have any questions, concerns, anything that you feel I need some support on, just let me know. But I don't plan on sending out any more emails just because I know that most of you are going to be testing soon. And I think you've got this down now. You understand Kaplan and how the grading is and when you feel that you're ready. And from what I can gather, most of you or all of you are following your plan. And if you're having any sort of kind of that feeling of despair, hopelessness, just kind of lost, again, I'm going to say it again and again and again, which I told you day one, please feel free to contact me. I'm going to go through this rather quickly only because I know everybody they're extremely busy and have a lot to do. And I wanted to do at least one of these again, just as a kind of a nice reminder. So, and kind of my last check-in, but via voice, not email. So, let's just get into it here. So we're going to start with our first question. And we are going to use the decision tree on all of these questions, starting with question number one, which is the RN is caring for a client who had a thyroidectomy 12 hours ago for treatment of Graves' disease. The RN would be most concerned if which of the following were observed. So the first thing I'm going to do is, of course, see that word most. So I know that I have a priority question, and I know that, and hopefully as you guys have been doing this, if you're using the Kaplan method, it just now is coming much more natural. You already know 1 through 5. You know the steps, and it's just flows. And I had told you that week one, and a lot of you looked at me like yeah, that's probably not going to happen, but it's amazing how when you really do practice it, it does. So I hope that for all of you that it just has become kind of like built in as a second nature. So okay, back to the question. So we have most. So we know priority, steps 1 through 5, step 1 being the topic. Our topic basically here, I'm looking at certain cues. And why is the topic so important? The topic is so important because we can go back and see, are we actually answering what the question is asking us? And I think that's why I always get confused and say the stem rather than the topic, because it really is, they're kind of synonyms to a point. But then we can go back and look and see, okay, am I actually answering the question that they're hoping that I am gaining from what they want and being a safe nurse? So what I can tell as far as topic wise is that we have a patient who 12 hours ago, remember, time is important. And this person had a surgical procedure. So I would say that the topic is priority of a patient who has Graves' disease and had a surgical procedure near the airway. That would be my topic. And again, my topic can be a little bit different than yours. It doesn't have to be 100%. Okay. As long as we understand what the question's asking, of course. And then I'm going to move on to my next step, which is going to be assessment versus implementation. So number 1, the client's blood pressure is 138, and then it gives the rest of the vital signs. We know that that is assessment because we're gaining information. Number 2, the client supports his or head and neck when turning his head to the right. That is assessment as well because we are assessing this happening. Number 3, the client and if you're not sure about that one, if it's kind of like, because even when I looked at it, I'm like, is that assessment? or is that, I mean, it's not really implementing anything, just keep it. So I'm just keeping it. Why not? Because I'm getting information. I feel it as assessment, and the book does as well, but I can see how that could potentially, book that I have, that you guys don't. So I would just keep it. So remember, you don't have to get rid of it. I'd rather you keep it than get rid of it. Okay, so we're going to keep number 1 and number 2 because they're both assessment. Number 3, the client spontaneously flexes his wrist when the blood pressure is obtained. That is assessment because I am gaining information and noticing something with my patient. And then number 4, the client is drowsy and reports a sore throat. So the patient's reporting something, they're telling me something. So that is assessment as well. So we're not able to get rid of anything at this point. So we're going to move on to Maslow's, which is physical versus psychosocial. So physical, yeah, sorry. I was thinking about pain. So number 1 is going to be physical. Number 2, physical. Number 3, physical. Number 4, physical. And I'm doing that one pretty quick because we can see that pain is really not a huge issue again, or is really not mentioned in any of these, except for number 4, it mentions sore throat. So that's another part where it can definitely, we can kind of get tripped up because it gives us 2 different things in this answer. The client is drowsy and reports a sore throat. So to me, I'm going to still keep that as physical. And again, if you're not sure, keep it. And yeah, so that's why I did choose specific questions. And hopefully you're able to, at this, again, being practicing and practicing and practicing and practicing. And as I had said, the more that you practice, the more that you'd be able to kind of get a better depiction. And I'd rather you keep it than get rid of it. But remember, even if you do get rid of it at the end, when you go back to the topic, if you got rid of it and none of the other ones are really giving the best outcome, in the end, you still get it right. It's an amazing process. We've seen it happen in class. So hopefully that sticks with you. So I'm going to go ahead and keep all of these and then move on to ABCs. So we know that number 1 is definitely ABCs because we have blood pressure, pulse, and respiration. So that's everything, A, B, and C. And then we have number 2, the client supports his head and neck when turning his head to the right. That is not an ABC, so I'm going to go ahead and eliminate that one. Number 3, the client spontaneously flexes his wrist when the blood pressure is obtained. They mentioned blood pressure, so that has to do with circulation. So at this point, we are left with number 1 and number 3. And then let's go down to number 4. The client is drowsy and reports a sore throat. That is not ABC. So we can get rid of that. So now we're down to number 1 and number 3, and we're going to go to our next step of the decision tree, which is what is going to be the best outcome for this patient. Okay, so then we need to use our critical thinking skills here. So we're going to go back up to the question, and it's talking about a thyroidectomy. And we know that a thyroidectomy is, of course, removing the thyroid. And Graves' disease is when we have because we have too much thyroid. So we're removing the thyroid. And when that happens, we have that beautiful little thing called the parathyroid. So, and usually thyroidectomy, you're removing part of it, because if you have Graves' disease and you have too much thyroid, you remove some of it, and then hopefully things level out, right, with your blood levels and whatnot. So, but unfortunately, what can happen is with the parathyroid, what can happen? What is the parathyroid? What is one of the most important things that it helps to regulate? And that is calcium. So that is what I'm thinking as my critical thinking part and best outcome for this patient. So, and I know this is 12 hours ago, so this can happen pretty quickly. Sorry, oh my goodness, my dogs are having a really good time this morning. Okay, so which one of these makes the most sense with the question that I am being asked here? So again, I like to read it. The RN is caring for a client who had a thyroidectomy 12 hours ago for the treatment of Graves' disease. The RN would be most concerned of which of the following was observed. So which of these am I going to be the most concerned of? So of course, I know I'm looking for things like thyroid storm. I mean, there's several complications when it comes to the thyroid because it's such an important gland and has so many different jobs that it does in the body with different hormones and systems and whatnot. So number 1, just by looking at this, the client's blood pressure, pulse, and respirations, as well as their temperature, are all within normal limits and fine. Yeah, I mean, slightly elevated with the blood pressure, pulse looks good, respiration's good, and I mean, just the slightest fever, that's completely normal, especially after surgery. So I'm not worried about that at all. That's actually, I'm good there, and I feel safe for my patient. Now I look at number 3, because remember, we're just left with these two, and I have to think back and think, okay, calcium. And I don't say the word right, but it's that thing where they do with the cotton ball on the cheek, Chavesky, or Travosky. You guys know what I'm talking about. And it has to do with calcium levels not being where they should be, and that can cause muscle twitching. So if it says here, the client spontaneously flexes his wrist when the blood pressure is obtained, that to me is indicating that the calcium levels are off, and that can potentially be very, very dangerous, because we know that calcium has to do with many different functions in the body, including the heart. So does this make sense? Yes. Does it go back to the topic of what we're talking about? Yes. And do we need to do something as far as me being concerned about it? Absolutely. So the credited answer here would be the client spontaneously flexes his wrist when the blood pressure is obtained. If you have any questions about these, you can email me too, by the way, or call me or text or whatnot. Okay, question number 2. The client is admitted to report severe pain in the right lower quadrant of the abdomen. To assist with pain relief, it is most important for the RN to take which of the following actions? I know that's not what it says. I made a typo. That's okay. Okay, so we see the word most. So I know that we're going to have a priority question using all 5 steps of the decision tree, starting with the topic. Our topic here is what is the most important action for a patient who has severe lower quadrant pain on the right side? Okay. And then we're going to move on to step number 2, assessment versus implementation. Number 1, encourage the client to change positions frequently in bed. That would be implementation. Number 2, massage the right lower quadrant of the abdomen. That would be implementation. Number 3, apply palpation, implementation. And number 4, use comfort measures and pillows, implementation. Then we're going to move on to Maslow's physical versus psychosocial. Number 1, encourage the client to change positions. That's physical. Number 2, massage the right lower quadrant. That's physical. Number 3, apply palpation. That's physical. And number 4, use comfort measures and pillows to position the client. That one, again, method to the madness, why I chose these. I can see why it might be like, well, that seems like it wouldn't match because it says use comfort measures. So that seems like psychosocial to me or whatnot, but it's not, because it's talking about doing and actually implementing something. You are implementing something. I know I'm jumping a little bit ahead. Or no, assessment versus implementation. I'm jumping a little bit ahead to the next one for Maslow's, but this is an implementation. Or I'm sorry, we're on Maslow's, my apologies. So this would actually be physical. This is something physical. Yes, we're helping and using comfort measures, but it's still something physical. It's not doing therapeutic communication. So really not getting too kind of into our heads, if you will. And we did a lot of talking about that. So unfortunately, we can't get rid of anything at this point, and then we'll move on to ABCs. So number 1, encourage the client to change positions frequently in bed. Nope. Massage. Nope. Apply. Nope. Use comfort. Nope. So now we need to use critical thinking. So again, I always go right back up because I want to make sure I know and stay on track of what I'm actually looking for. We have severe pain. It's in the right lower quadrant of the abdomen. And we're talking about pain relief. That is what's important. That is really, really the topic, pain relief. It says right here, what to assist with pain relief, it is most important for the RN to take which action. So by looking at all of these, which in the moment can we do right now out of all of these to help? Encourage the client to change positions frequently. Okay, is that really going to help? I mean, possibly. It's not specific enough. So I'm going to hang on to it for a reason, because I want to show you something. Then number 2, massage the right lower quadrant. Of course, we would not do that because we don't want anything to accidentally burst, as number 3 talks about with palpation because of the appendix. So number 2 and number 3 are just not safe. Then if we look at number 1 and number 4, they're very similar. However, one is more specific. Use comfort measures and pillows to position the client. So we're actually listening to our patient. They're telling us what's helping with the pain, and I am able to assist with pain relief in the immediate until, we get the orders to do further. So the answer here would be number 4, which would be use comfort measures and pillows to position the client. I really like that question because I think it has a lot to do with a lot of critical thinking. Okay. Last question. Which of the following actions by the nurse would be considered negligence? This is important, and they're getting a lot more of these questions on the NCLEX from what I was told, because, we really need to be careful. Nurses, we, just like with any profession, we get comfortable. We really need to stay on top of our stuff because things can happen. Actually, unfortunately, we had a suicide. I work in outpatient. It's much less common where I'm working in my department, and we haven't had one, I think, in 5 years, and we had one. And not saying anyone did anything wrong, but just we can, and myself too, we can get comfortable, and it's a good reminder to not ever get comfortable. So I really thought this question would be important. And there's a lot more state board investigations now with negligence. So I thought this would be good to throw in there. Okay, so which of the following actions by the RN would be considered negligent? So this question is basically looking for something right. So we know we're going to use steps 1 and 5 of the decision tree, starting with step 1, which is basically finding the topic. The topic is what would be considered doing something that is not safe and helpful, best outcome for our patient. Then we go down to step 5, which is what is the best outcome for the patient. What is going to be the best outcome? Number 1, administering sub-Q heparin into a client's abdomen without first aspirating for blood. Nope, that one's good because we know that we don't do this and we don't aspirate for blood. So that is not considered negligent. Number 2, crushing furosemide, which is Lasix, and adding it to a teaspoon of applesauce. If possible, try not to overthink this because I know we're like, oh, can we crush it? Can we not? I don't know. Okay, let's pretend we don't know and let's keep it. You can, by the way, but let's just keep it. Number 3, lowering the bedside rails after administering Demerol and hydroxyzine to a client post-op. Would this be considered negligence? Well, we all know that we don't want to lower the bedside rails and have the bedside rails down, especially if we have a patient who's on Demerol, which is a very strong opiate, and then hydroxyzine, which is an antihistamine, also called Vistaril, and it can cause extreme drowsiness, and the patient's post-op. So they've had anesthesia. So this is a very dangerous game we're playing here, if you will. So we know that number 1 is now gone. Number 2 and 3 we're keeping. And now let's go down to number 4 to see if this one's negligent. So then we could kind of process of elimination. So number 4, placing a used syringe and needle in a sharps container in a client's room. That's completely not negligent. That is exactly what we should do. We want to discard of our sharps in the proper manner, and that's why the sharps container is put in there. We don't want to leave the room with a needle, right? Boom, immediately, as quickly as possible, let's get it in that sharps for safety. So we're now left with 2 potential answers. So when we have to do this, we go back up, we're looking for something that's considered negligent and wrong. If I had to choose, even if I didn't know that I could crush this furosemide, which one of these is going to be the most negligent? Am I going to hurt the patient if I crush the furosemide and gave it to him in applesauce, even if I wasn't supposed to crush it? The chances would be so slow. I can't, unless you gave them more than you should. Again, we don't want to do things that we're not supposed to do. I'm just making a point. So if you're not sure, and we compare the two between crushing the furosemide and giving it with applesauce, which we do all the time, especially for our patients who are having trouble swallowing, or our patients that are in the skilled nursing facilities that may be a little bit older. We do this all the time. Or number 3, lowering the bedside rails after administering Demerol and hydroxyzine to a client post-op. Now, what I don't like about this, and what I think is confusing and why I picked it, another reason, is because it doesn't say how long. So that's why I think it's really important not to make a story. I wish it would be a little bit more specific, such as like lowering the bedside rails and answering a call light next door, because that would make it much more clear, but it doesn't give that information, and the NCLEX doesn't always give it. So you have to make that judgment call. And from all 4 of these, we know number 1, number 4 are okay. It really comes between number 2 and number 3. It's all about safety. So what is the most, and they're giving you a hint by saying Demerol and hydroxyzine to a client post-op. So even though it doesn't say that how long the bedside rails are down or giving more information on it, they're still saying it, and they're mentioning very sedating medications. So that could potentially be a huge problem with a patient falling. So that would be the accredited answer as far as having negligence. So I hope that was helpful as far as going through the decision tree again and kind of giving those, like, oh, when you get frustrated, like, and not know what to do. And don't forget, you can keep answers. You don't have to get rid of them, and, not reading too far into it. And sometimes if you don't want to use it, you don't have to. I still think it's helpful to kind of have that safety net and still use it. Again, if you have any questions about any of what we just did, let me know. I didn't want to do like 50 questions or anything like that, because at this point, I think you guys are good. You have your letters, you're making your appointments. Please, 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 if you would be so kind to email me or text me or whatnot when you pass your NCLEX, and or if you feel that you need some support. And I miss all of you very much and our time together. And I hope that you are all feeling, one day is probably going to be really stressful, and one day is probably going to be like, yeah, I'm doing great, as I explained earlier. So anyhow, I won't keep you any longer. I will get this sent out, and I hope to see you on the nursing floor very, very soon. And I hope you have today's Monday, so you have a good rest of your week. Thank you so much. And I am here if you need me.